is Monica. I am an OET and IELTS trainer, and in this video today, we are going to look at reading extracts from official OET papers and learn vocabulary words that we often don't take notice of. Now, these vocabulary words could be simple words that you don't know the meaning of, or these could be collocations or even idioms. Remember, collocations and idioms are those words which are easily understandable and very natural to the native English speaker, but not as easily understandable for us non-native speakers. So these vocabulary words we are going to learn with the help of simple examples and explanations. We're also going to look at how these words can also be used in your OET writing and speaking. Now, the big question is this video going to be helpful for you? Should you watch this video? Well, in that case, please understand this video is going to be helpful for those students whose vocabulary is not the best, due to which they have a hard time understanding the meaning of paragraphs. And remember, if you misunderstand the meaning of your paragraph, no method in the book can actually help you find the right answer then. And this is why I'm going to keep this video short for your benefit and your attention span, but more such videos are going to follow. This video is also a helpful resource for those students who don't have the time themselves to look at reading extracts and write the word and meaning and use it in different examples. So I hope you find this video helpful today. Everyone, so today the first word that we have is called implications. The word implications actually means the effects or the results of something which are usually not that great. So the effects or consequences of something that might happen, they have not yet happened. Now, the implications word is not usually used alone in your OET writing. It is often used with other words like serious implications, immediate implications. Now, serious and the word immediate, they actually act as adjectives which give us more information about the kind of implications that a person might experience or that might arise from a situation. So it's very commonly seen, this particular collocation being used with other kinds of adjectives like negative or positive implications, global and social implications, direct, indirect effects, that means direct and indirect implications, unintended and intended implications. It's very commonly seen in any kind of reading articles. So you can definitely expect to see this word later on in your reading as well. Now, the paragraph here that actually has this word, what does it mean? Well, it says that displacement of nasogastric feeding tubes can have serious implications if undirected. So if you're not directing it properly, it can have very severe or serious implications. So because they wanted to highlight how severe it would be, they have used the collocation together, serious implications. Now, not just in your reading articles, but implications word can very easily be used in your OET speaking as well, especially when you want to highlight the problems or the implications or the negative effects of something to your patient. Let's assume you're a doctor or a nurse and you're dealing with a patient who may not want to listen to your advice, who may not want to follow a particular method, something like that is going on, and you want to highlight to them how important it is for them to actually follow your advice, because if they don't do it, they might experience something negative as a result. Let's look at this example here. There may be potential implications of adding new drugs to this medication. So that means if we add new drugs to this medication, then we might experience, or the patient might experience, some negative side effects or complications. Similarly, it is very, very common for any doctor or nurse to get a patient who is just so bored of the situation and they just don't want to listen to you. In that situation, to convince them, to show them why it is a good idea to actually listen to your advice, is always using this word implication. For example, here the patient says, look, I want to get better. I just feel that I would be better off at home. I cannot stay in the hospital anymore. I think it's very boring here. Here, the doctor can say to the patient that, listen, I understand how difficult it can be to stay in the hospital for a long time. However, You need to be rational about this and consider the implications associated with going home at this point. So, by doing this, what have I done exactly? By doing this, I have told my patient, listen, I do understand what you're saying, but at the same time, it is also very important that you understand if you go home at this point, there might be some implications that you might experience. We have done this beautifully without actually scaring the patient by saying, listen, you need to stay here. If you go home, you'll suffer complications. No, because in OET speaking, we do not want to scare our patients into agreement with us. No, we want to understand their point of view and we want to slightly warn them that listen firmly that this might happen if you don't follow my advice. This is a very interesting word here, and it is also very commonly used in medical context. We'll come to that later. But first of all, understand when I say vulnerable and when I say vulnerable too, they actually do not have the same meaning. They have slightly different meanings. When I say I'm vulnerable, that means I can be easily harmed. I am open to being harmed, but I can be harmed exactly how? I can be harmed emotionally, physically, mentally. How exactly? That I have not yet specified, which is why vulnerable does not give me the complete information. But when I use the collocation vulnerable to, at that time, I am clarifying what kind of harm I am open to. And that kind of harm has to be written right after the collocation vulnerable to. For example, if I'm saying I'm vulnerable to emotional harm, that means I can be easily harmed emotionally, or I am open to harm emotionally. If you want to understand this better, let's look at the sentence in the paragraph. Well, the paragraph says that incorrectly positioned tubes leave patients vulnerable to something. It basically says the tubes, the nasogastric tubes, if they are not positioned properly, then your patients are at risk of regurgitation, respiratory aspiration. So that means you are leaving your patients open to harm in what way? Well, by regurgitation and respiratory aspiration. Let's understand this with another much simpler example. So here in the next example, we say that the kitten looked vulnerable. So that means the kitten looked in a state which made it seem that she can be easily harmed. The kitten can be easily harmed. But when I say the kitten looked vulnerable to predators, that means that the kitten can be easily harmed by the predators, or that the kitten is very easily harmed by predators. That's what we mean. The collocation vulnerable to is something that you will see again and again in your reading articles. Now, the word crucial actually means that something is extremely important, really important, very important. So if you want to avoid the word really, very, you can definitely use the word crucial. And you can use other synonyms as well, which are also commonly used in your OET speaking and in your OET writing. In fact, in articles as well, these words are used commonly. Why are they used so often in articles? Because these are formal ways of saying that something is extremely important without actually repeating the word important. So here, paramount, imperative, essential, critical, and vital. All of these words can be interchangeably used with the word crucial. For example, it is crucial to wear a helmet when riding a bike to protect your head. So it's very important to wear a helmet for you when you're riding a bike so that you can protect your head. Similarly, in the paragraph, they say it is crucial to differentiate between gastric and respiratory placement. So they are saying that it is very important to differentiate between gastric and respiratory placement. Now, like I said, that this word can be used in your OET speaking and writing as well. Let me show you that in your OET speaking, you can use this word when you want to highlight the importance of doing something to your patient, whether you are a nurse or you are a doctor. You both can use this word while talking to your patient rather than repeating the term. It's important that you do this. It's very important. It's really important, sir, ma'am. You can use the word crucial. It can also be used when you're dealing with reluctant patients, because patients, when they are reluctant or when you're trying to persuade them, you are trying to explain again and again why something is important for them to do. It could be a patient who is very angry or who's saying that I need to see the doctor now, but you're again and again explaining to them that why it is important for them to wait right now. Or it could be a patient who's saying that, listen, I need to get the medications now. So just give me any medication that you have, and I'll be on my way to my home. So you need to explain to them why it is important for them to wait for the doctor to examine them first and then get prescribed medications rather than taking any over the counter medication. Similarly, we have a situation here where the patient is saying, I don't understand why I need to get these vaccinations again when I already got them years ago. It's a hassle, really. Here, the patient is actually very frustrated that she has to get the vaccinations every year when she already got them last year. So she is quite frustrated regarding this. So you will need to explain the importance of getting these vaccinations to her. So rather than repeating the word important again and again, you can use the word crucial here by saying, I understand your frustration, but it's crucial for your protection to get these immunizations because some vaccinations need to be repeated everywhere so that they can work effectively for you. So, by using the word crucial here, you eliminated the need to say, you have to get these vaccinations, you must get these vaccinations, you have to, need to, it's very important you do this. Well, crucial is just another word for those, and you get more marks in your lexical resources as well when you use words like crucial, imperative, paramount, rather than repeating the same word important again and again and again. Now, I want you to look at these examples, which clearly show the usage of crucial in the same meaning in different example forms. Now, it's interesting to me that we can use these two words in different ways. When I use the word initial, I'm using it as an adjective to give more information about something else. And especially when I want to describe that it is actually the first or the beginning state of something. For example, in the paragraph, when I say initial insertion, I am specifying that I'm talking about that insertion that happens for the very first time, the very first insertion. If I say that it is crucial to differentiate between so and so things, or it is crucial to differentiate between initial insertion to prevent potentially fatal pulmonary complications, I am saying that for the very first time, when you're inserting the nasogastric tube, it's very important you do it right so that you can prevent potential complications, severe complications later on. right? So I am specifying that it is the very first insertion that you need to be careful about. Now, the word initially acts as an adverb. So that means that when I talk about a verb, an action word, and I want to give more information about it, I will use the word initially here to describe an action or state that actually occurs at the beginning. Now, even though they are both doing the same thing, grammatically they are used differently in both your OET speaking and in your OET writing. So, for example, you're writing a letter in which the patient has actually visited your facility or your institution multiple times, and you want to tell the reader that, listen, for the very first time when they came to me, that was 2 weeks ago, or that was on this particular date. So, you can say that she presented 2 weeks ago, but it does not tell me that it was actually the very first visit. Here, using the word initially is actually going to be beneficial for you. So you can say, initially, she presented 2 weeks ago with complaints of cough and headache. Similarly, I can say that initially she responded well to the medication but developed side effects to it later. That means at the early stages of when we had prescribed the medication to her, she was responding to the medications really well. But later on, or subsequently, she actually developed side effects to it. So, initially can actually be used very, very, very professionally in your OET letters, but not just in OET letters, it can also be used in your OET speaking as well. For example, you see the ones in For example, you see the word initial assessment. So it means during the first stage of assessment, during the first period of assessment, or when I say initial conversation, I meant the conversation that we had for the first time. Or when I say initial steps, I'm talking about the very first steps. This statement, during the initial statement, during the initial assessment, I will need to ask you some questions about your medical history. So here, the nurse or the healthcare professional is actually clarifying, what am I going to do when I do your assessment? Well, during that first stage of assessment, I am going to ask you questions about your medical history. Now, in the second statement, you see that we are actually reassuring our patient that, listen, the very first steps of losing weight are difficult for everyone. A lot of people have difficulty in taking the initial steps to lose weight so that they don't actually feel that they are alone in this. Similarly, the last statement, which says, based on our initial conversation, I believe you need to consult with the doctor to get an assessment. So that means based on the very first conversation we had, maybe it talked about symptoms, it talked about some concerns that the patient has, but I'm referring to that conversation. I'm saying that based on our initial conversation, I believe you need to consult with the doctor to get a proper assessment or to get a diagnosis. In these ways, you can use initially and the word initial in your OET speaking and in your OET writing. The word fetal, when it is used as an adjective, it gives us more information about something. That something could be disease, condition, event, person, people, whoever, right? Something that has the potential to lead to death or that can very likely cause death as a result. But when we talk about medical situations, we usually use the word fetal with conditions or with injuries or with events that actually do result in death or that have the potential of resulting in death. To talk about the severity of those situations, for example, the very first example says here, the accident resulted in fatal injuries to the driver. So, fetal actually tells me that those were not mild injuries that could be easily treated, but those were deadly injuries. Similarly, the medication had potentially fatal side effects if not administered correctly. So, if this medication was not administered correctly, It could lead to potential fatal, very, very serious, very, very deadly side effects that could also result in death. And the last example, which says the surgeon warned that delaying treatment could have fatal consequences to highlight the severity of the kind of result that could happen or the negative effect that could happen. I've used the word fatal here. Now, if I want to highlight the severity of something really, really badly like this, then I can use the word fetal even in my speaking, especially OET speaking. But remember, you should not use the word fetal consequences right when you're trying to convince your patient for the very first time. Don't tell them that they will suffer from fetal complications, fetal implications if they do not follow your advice. No. If you do that, then you can potentially scare your patient. And in OET, we do not scare the patient. We firmly advise them against something or we recommend something. So you should use this with a reluctant patient when you have tried to convince them maybe 2 or 3 times and they're just not listening to you. And in the end, you could say it could have serious complications, implications, fatal consequences. At that time, you can use this, but not to scare it, only when it is appropriate for you to use it. Coming back to the paragraph we have here, it says that initial insertion to prevent potentially fatal pulmonary complications. It means that the pulmonary complications that could happen, those would be fatal. Those could result in death. Those could be more serious. This word will be used in your medical context, like I said early on, with conditions, injuries, and events that do result in death. So it's very commonly seen in your reading articles which talk about trials and which talk about deaths and some serious consequences. And it can be used in your OET speaking as well. So I hope you found this video helpful for you today. And now you can watch a summary of all the words that we have actually learned from this video today. Here's the summary.